Good afternoon to those on the East Coast, and good morning to those on the West Coast. My name is Ruben Rotman. I have the honor of serving as the CEO of the Network of Jewish Human Service Agencies. And it's my pleasure to welcome you and to thank you all for joining us today for the second of what will ultimately be 3 plenary sessions for this year's NJHSA annual conference. Our first session, held last month, addressed the timely topic of diversity, equity, and inclusion. Our next session, scheduled for July 22nd, will address services for refugees, and today's session addresses the pressing topic of poverty. As many of you know, we had planned to be together in person this year in Dallas. While it is truly disappointing that we are not able to be together in person, it is gratifying that our network continues to come together, even if only by Zoom, to support each other and to continue to find ways to grow our collective impact to better serve our communities. Our plenary sessions for this year's conference were designed with the goal of presenting a topic of critical concern to the field of human services and to show our network's response to that topic. The content for each of these signature sessions has now been updated to also include the impact of COVID-19. Today's session will address the topic of poverty in the U.S. and implications of COVID-19 in developing and delivering innovative responses. We will also hear today from 3 member agency teams that were selected from our Jewish Poverty Challenge to participate in an intensive incubation program. As is the case with all of our virtual programming, the slide deck from today's presentation, along with the recording, will be posted on the members portal of the network's website. During this period of COVID-19 disruption, we have opened all of our programming to extend beyond our member agencies. For the non-member agencies joining us today, please be in touch with us separately, and we will be glad to share the materials with you. Before beginning our session, I want to acknowledge the special partnership we have with Mutual of America, the presenting sponsor for today's plenary session. It is my pleasure to introduce Renee Hsu, the Vice President of National Accounts with Mutual of America, who will share some opening remarks.
Thank you, Ruben. Appreciate the opportunity to be with everybody today, and welcome to this wonderful, informative session. Mutual of America has been around since 1945. The funny thing is this year we actually celebrate our 75th anniversary of being in business. We've been working with a network for many, many years. Our partnership actually dates back to 2005. And we've seen the network go through a lot of changes over that course of time. But Mutual of America has always remained a strong partner of the association, and we believe in the mission of what you folks do. To give you just a little sense of who we are a retirement plan provider, and we work with entities of any nature, corporate, nonprofit, governmental, you name it. In fact, most of our clientele is nonprofit organizations. So 85% of our clientele are nonprofits. And we understand this market very well. We understand the challenges that you face in recruiting, in retention, in fundraising, in revenue challenges, you name it. We have withstood this period of time for a reason. And that extensive expertise that we bring to the table for retirement plan services and benefits for you and your employees, well, that's expertise that you can really rely on. So some of the things that we work on are 401ks, 403bs, money purchase pension plans. I know I've worked with a lot of you on your 457B plan. defined contribution plans such as a profit sharing plan and such. So when you look at your benefits package and what you need to do to strengthen it or just evaluate it, we hope that you'll look towards Mutual of America, because in partnering with the network, we have over 40 million assets under management for the association in particular. And as a preferred provider for the network and all of the members, we actually waive certain administrative fees. So this can bring a lot of savings to the table so that you can put those dollars in other programs. So this expertise and savings that we bring to the table, we really hope that you look at us and turn to us so that we can help you strengthen your benefits package as a whole. Ruben, want to thank you for the opportunity today to just give this small presentation on who we are. We really look forward to a great session here this afternoon. Thank you.
Thank you, Renee, and thank you for your ongoing partnership. At this point, I'm now pleased to introduce John Coburn, the COO of JEVS Human Services in Philadelphia. John serves as the Vice Chair of our network's Board of Directors, and this year served as the Chair of the 2020 Annual Conference Plenary Session Subcommittee. John will introduce our presenter for today's session.
Thanks, Ruben, and happy to be here. Happy to have all of you joining us today to explore this really critical topic, and now even more critical topic of poverty in the United States. Today, we're going to have a mix of peers, of old friends who have been working with the network for a while, and some new friends to help us explore some of the issues of poverty that we face in this COVID-19 world. And helping us to kick off this conversation is one of our new friends. We are pleased to have with us Luke Shaefer. Luke is, as the slide says, Director of Poverty Solutions at the University of Michigan, but he's more than just your sort of standard academic. He's a thought leader, a public intellectual, and somebody who really helps connect the research that he's been doing on poverty with on-the-ground solutions. So we just couldn't be more pleased to have Luke with us today. I'll say one last thing, which is that we're going to be having an opportunity to do some Q&A with Luke. And so I would encourage you to use the chat feature of this webinar to pose any questions you may have, and I'll be helping to facilitate that section of the presentation as well. And so without any further ado, I'm going to turn this over to Luke. Luke?
Hi, John. Thanks so much. That was, I like that introduction. I hope to live into the way that, that you described my work. Yeah, I'm a professor at the University of Michigan, and so I just wanted to tell you a little bit about our work and how we've been trying to redefine how a university goes about the work of poverty. I run this initiative called Poverty Solutions. We get our charge from President Schlissel at U of M to really get out of the ivory tower and partner with communities and policymakers to find new ways to prevent and alleviate poverty. In my own work, I started my career as a data nerd. So nothing makes me feel happier than a spreadsheet or a chart. A really well done chart just makes me feel warm and cuddly inside. And I think I did a lot of really good, solid work trying to understand the safety net, trying to understand things like unemployment insurance and how it was difficult to access for a lot of workers, especially workers sort of at the margins of the labor market. Well before COVID really, I think, showed how important those differences are. Research on food assistance, supplemental nutrition assistance program. But it wasn't really until I entered into a joint project with Kathy Eden on a book called $2 a Day, which was about families living on really, really extremely low cash incomes. Families who might have SNAP, might have food assistance, sometimes might have public health insurance, but what does it mean to really live in 21st century America with no money? So we tried to combine the data. We tried to combine survey data and administrative data with on-the-ground experiences of getting to know families in Chicago, Cleveland, Appalachia, and the Mississippi Delta, and really allow them to be the experts. And that was where I really learned a lesson about the fact that in my positionality as someone who studies poverty, even as someone who grew up without a lot of money, who not having a lot of money was part of why I got into this work to begin with. Even with that long-term experience today, from where I sit, sometimes I don't even know the right questions to ask. Sometimes I really don't deeply understand what's impacting families at the very bottom. And just to give you one example of that from the book, so as we got to know moms and their kids, especially, and sometimes dads, in different parts of the country, we would see a little divot on the inside crease of a lot of the elbows of the moms. And I will say, sort of, when I first saw that the first time, I immediately went to the notion that that was probably some sort of drug track line, that the mom I was talking to maybe had a substance abuse problem in the past, which I think speaks to the power that when we talk about poverty in this country, we never come as a blank slate. We always come with a set of images, a set of narratives, a set of assumptions about people, whatever those may be, right? But there's some very dominant ones that sort of come along. In fact, it was a scar from selling blood plasma so often, right? And we saw it time and time again. In Cleveland, you know, the bus stop stops right in front of the plasma center, and everybody on that bus gets out. You can watch it sort of throughout the day happening. They go right into the plasma center. Often a public benefits office will be right next to a plasma center. And so we were really interested in that. We wanted to go back to the data. And the International Plasma Trade Association is very proud of the fact that blood plasma sales have really been on an upward trajectory. So we can see, actually, the most recent data is in from 2019. I didn't get a chance to add that, but we're up to 52 million paid plasma donations in 2019. So that's almost triple where we were during the Great Recession and quadruple where we were in the mid-2000s. We've geocoded all of these plasma centers. We can tell they're disproportionately in communities of color and in poor communities. So we start to get a sense for what's going on, why people are selling their plasma. It has a lot to do with the same reasons we met families who were doing it. It was a source of money. But that really only tells a piece of the puzzle. Another part of it is that global sales for plasma have quadrupled from 5 billion in 2000 to 20 billion in 2015. And the United States accounts for 70% of the world's plasma supply and only 40% of the demand. So that means we're exporting the blood plasma, mostly of poor Americans, all around the world in what is an incredibly profitable industry. So this is a great source of conversation and debate in my classes. Should people be able to sell all their plasma? Well, what are their other options when they don't have a functioning cash safety net? Should they get more, right? Is the plasma companies being exploitative, right? Or is this a really fair market transaction? To me, there were two stories here, two important pieces. The first was that I was a poverty expert. And before I actually went out and got out of my office to go talk to people, I didn't even know this was a thing. This is a major phenomenon in Texas where we were all supposed to meet. I'm really sad not to be there. I think a third of the plasma centers are there. They're all along the Texas-Mexico border. And so there's a major phenomenon going on that I knew nothing about, and I was a poverty expert. The second part of this is that the experiences of poor Americans were embedded in a system. I think often when we think about poverty, we tend to think of it as a microcosm. This is a thing that's happening to people. It doesn't affect me. It doesn't affect where I work. Maybe I work for an insurance agency. Maybe I work for a healthcare. But the issues of poverty in our country are almost always embedded in a system. And at Poverty Solutions, we've really come to believe that to reduce poverty in a transformational way means not just helping poor families navigate systems, right, with mentoring, although that's important, not just helping people manage their incomes, but really looking at a set of interlinked systems. We've seen some pretty serious ones on display in the last couple of months, right? Criminal justice, healthcare, schools, our safety net, right? All of these things are interlinked systems, and often they don't work as they should for vulnerable families. So to reduce poverty means tackling, in our mind, using a systems approach, trying to understand how does what we're seeing really fit into the broader picture of what's going on, and then really trying to do something about it. We believe to reduce poverty in a meaningful way requires concrete, actionable progress. This can be small, medium, and large. So a lot of the times I think about, I challenge you to think about your agency. What can you do tomorrow that will make a system work better for the families you serve? What could you shoot to do next month or in the next 3 months that will do the same? And then what's the bigger picture, right? What maybe are we going towards as time goes on? We want to think about concrete, actionable progress steps that will improve the way systems work for families. So we have this sort of chart as our North Star and how we like to do this. So at Poverty Solutions, we like to try to begin with community input, start with listening. When we started our work in the city of Detroit, I can say I could go in and have a whole assumption of what's going on with families and what they're being challenged with. But I might be missing a big piece of the puzzle. I might be missing the things that matter most to them unless I listen. And then I think as analysts, as scholars, we have a role to play, that we can bring access to data and analysis, and then we share those findings in a way that has policy solution possibilities, right? So we're not going to set the agenda of what should be done, but I do think it is our role to try to set those out as possible ways to move forward. As policymakers and communities choose what direction they want to go, we can support that implementation. And then the final piece of the puzzle for us is to evaluate the outcome. It doesn't matter how well-intentioned and well thought out a policy proposal was, a change at an agency or at a city or at a state level, if it doesn't actually result in real change for families. When we started the work in the city of Detroit, so we have a partnership with the mayor and his team on economic mobility, and we started with listening. And I can tell you all the things I thought mattered in the nation's poorest large city. But one thing that was not on my mind was the high cost of auto insurance. So the same policy that costs something around $900 or $1,000 nationally, in Ann Arbor, where I live, that same policy costs an average of $2,100. In the city of Detroit, $5,700. That's 20% of the total median income for a Detroiter. So it's up to us to really embed that and understand, why does that affect poor families? Well, you can't possibly put 20% of your entire annual income towards auto insurance. It's irrational. So Detroiters make a lot of decisions. They drive uninsured, and that has rippling consequences. They might say that they live somewhere else in order to get auto insurance. That's insurance fraud, but it's rational. So understanding why the system doesn't work for families and how they react to it. And then also understanding what is the system by which this is embedded in, right? It turns out in Michigan, we just had this very unusual set of policies that led to a kind of coverage for personal injury protection that you don't get anywhere else. It actually wasn't bad intentions, right, when that was passed. But it did turn out that a lot of people make a lot of money off of this system. It's embedded in a larger system. And trying to understand where that goes is the only way we can actually help confront it. This is just one example from a survey that we do in the city of Detroit of, when we ask families, if we're going to really address transportation and mobility reforms, what do you care about? And you can see overwhelmingly lowering the cost of auto insurance was the top pick. What families really didn't have as a priority was creating more bike lanes. And to me, that's the question of often, what is the policymaker or the executive director or the program staff, what are their priorities? And what are the priorities of the folks that they serve? And what does that mean? It's a reasonable thing to say that we believe there should be more bike lanes, that we want to encourage people to bike. It's better for the environment. It's better for them from a health standpoint. But what does it mean if we don't address what they are clearly saying as a top priority? Or perhaps if we're able to do something about the cost of auto insurance, maybe people will be more interested in bike lanes. So just to start this conversation, I'm looking forward to the back and forth with you. We believe that reducing poverty in a transformational way means addressing multiple systems. So even the most effective program won't move the needle on poverty in a community. Those types of programs, I think, that affect people and affect families only have to be contextualized in broader systems change. We think scholars and analysts have a role to play in research that can be critical to that change by informing action. But often scholarship only goes to the level of knowing what works. We think that's only the starting point. We think that has to be done in conversation with people and also start to say, what should we do? So we want to embed our work in an understanding of systems and connect our work to direct action. And all of this presumes that we have to remain connected to the lived experiences of those we study, or we're going to miss a lot of what's important. So with that, I'm really happy to be with you, and I'm really looking forward to a conversation and hearing about some of the exciting efforts that are happening in your network.
Luke, thanks so much. That's fabulous context for our work. Let's start with your systems analysis. And, I think certainly speaking for the organization I work for, we are deeply embedded in that system. We are operators of a welfare to work program. We run the unemployment office for the city of Philadelphia. We are deeply, deeply in the system. What does it take for an organization that is deep into the system to be able to ask some of those fundamental questions? How do you do that? And if you have an example of organizations you've worked with that have gone through that process, it'd be helpful to hear that.
Yeah, so I am a really big believer in the small, medium, and large, right? I think we think of systems change as having to be like, let's totally revamp, let's go to universal basic income or Medicare for all. To me, those things are conversations we should have, but also when you're in a system, you can see how it works and how it doesn't, where people really get caught up, right? Where the system level issues happen. And I think that's a place where you are particularly well positioned to make those recommendations, make those changes. So I can talk a little bit about my work with the Department of Health and Human Services. So I serve as a special counselor to the Director of Health and Human Services for the state of Michigan. And our goals, many of our strategies are around making the programs we have simpler for families, right? And more straightforward. So they have to do less to sort of get through the hurdles of getting food assistance or energy assistance than other people. A couple of examples of that is last fall, we did a thing where we raised all of our asset limits across our public programs. So if you think of TANF and food assistance, we went to, they were all at different levels. We raised them all up to 15,000 and standardized them, right? And that has the effect of simplifying things. So you don't have to have caseworkers that are looking for, okay, this one's 500, this one's for 2,000, this one's 2,000, but it excludes cars, right? Try to do everything the same as much as possible. Has that simplifying effect. The second most important thing is that we went to self-attestation. So virtually nobody who applies for food assistance actually has assets above whatever level we set it at. But everybody has to collect, their bank records, all sorts of information. So we just said, in this particular case, you just tell us what you have and we're going to trust you, right? And if you're defrauding us, then there are going to be penalties. But we think, especially with raising the levels, that has, very few people, even if they get it wrong, are going to be above that threshold. So that might, that particular example might not be possible in whatever sort of system you're working in, but I bet you can find the things where like, a lot of people, they seem to drop out of an application process because we request this thing, X, Y, and Z. A lot of people fill out this form in the wrong way. we're looking for those patterns and figuring out what's the change we can make that will make things a little bit better tomorrow. And I love those wins, right? Every day that's a day that I get to do one thing that changes how a process works in a way that helps families is a day that I sleep well, or am most likely to sleep well, depending on whether or not my kids wake me up.
So let me turn to, thank you for that. Let me turn to our current situation and ask you to reflect on what, if anything, you're seeing as sort of early indicators of how COVID-19 has shifted the experience of poverty in the United States, or how it's shifted how some of those systems operate, or how they might operate in a COVID-19 and post-COVID-19 world.
Yeah. So I think the response to COVID has been fascinating. So I've studied unemployment insurance and the difficulties of accessing unemployment insurance, especially for people of color, especially for workers who are in the service sector, which is where a lot of poor workers are located. And the CARES Act, the federal legislation, kind of like the way that they designed that in designing a whole new system called pandemic unemployment insurance, I think was a recognition of the fact that that program has issues, right? Where we said, okay, we have like 30% of our workforce, you know, estimates vary, but I'm going with about 30% in like contingent work and 1099, ride sharing, gig economy. And they are just categorically generally excluded from unemployment insurance. And that's not gonna work for us. And so we created an entire new program, had to be rolled out across states and was rolled out at varying speeds to try to fold them in. So I think that was a real recognition of the fact that that system, it's not a reasonable social insurance program for workers in America, because jobs look a lot different than they did in 1935 when it passed. It also increases $600, right? So, and a recognition that the benefit levels in most states on unemployment insurance were too low, everyone was plussed up by $600. And that was, I think, a recognition that you know, in Michigan, you could get something like $300, right? And that's $300 a week, and that wasn't reasonable to expect people to live on, right? So that's one set of changes. Another one is the economic stimulus check. So through my own work, I have done a lot of work about how there's a lot of very poor families who might not have earnings, or they don't have continuous earnings. They might not file for taxes. Other people's work has showed they don't have bank accounts. The economic stimulus check was actually, I think, a recognition of that fact, in that eligibility included everyone down to zero earnings, right? You don't have to have earned anything. And I think that was the recognition of a lot of work of many of us in trying to address that. Many of our very poorest families are left out of some of our structures. They're good structures, like the earned income tax credit, but they don't cover everybody. So we need to do something about that. In both of those cases, those were temporary measures. And the fact that they were temporary and we had to bring them all up, right, at the drop of a dime, was part of why there have been some challenges. So I've been looking at recent data that suggests still 30% of SNAP recipients, it's not a representative sample, but I have a lot of observations, 30% still haven't gotten their economic stimulus check, right? We are months into the worst economic crisis of modern times. We did like one thing, you know, one major thing for families that didn't require work, and 30% of the most vulnerable families still haven't gotten it. That is what I think suggests we need to sort of build on some of these recognitions for longer term change. And I frankly don't know what direction we're gonna go in. I've been doing poverty work enough to know when the economy tanks and sort of the narratives of deservingness switch a little bit, that people are a little bit more open to more generous policies that look to include rather than exclude. But usually when things improve, something shifts, right? The balance shifts and we go back to making it harder to get benefits. Part of what happened to us with COVID was going in, we were in a period where we were making it harder for people to get everything, right? It was, most states were reducing the number of weeks of unemployment insurance. Most states were making it harder for, you know, adults to get food assistance. Our cash safety net continues to like shrivel into nothing. And so I think we're definitely at a point where we could go in two directions. We could say, you know what, you know, we've seen the need, it's real, it's in our faces, sort of this pileup of cars going into food assistance. And we need to make some changes so that both we protect families more overall, but also that we're more prepared for this in the next time. Or I think we could go back, you know, with selective amnesia, just exactly to the way we were before.
I want to just encourage anyone to use either the chat box or the Q&A function. So if you've got any questions, feel free to put them in and I will relay them to Luke. I wanted to turn from the policy discussion to a little bit more on the ground. So certainly many of our organizations will work on advocacy issues around some of those policy levers that you've cited. But what about on the ground? For those of us who've been working on poverty issues, we've almost overnight gone from tight labor markets to massive unemployment. We've gone from a place where a lot of our focus was on connecting people to open jobs in the economy and doing skill training and so on around that, to now having to deal with folks who have lost jobs in sectors that seem like it could be very slow to come back. So how do you think about a poverty approach for the on-the-ground organization? What are the kinds of strategies that those organizations should be thinking about in the months and maybe years ahead?
Well, I think I think every sign points to us being in an extended recession that'll be quite severe. So unemployment remains high. It actually went down in the last numbers, which was a surprise to most people, but still is as elevated as it's been in modern times. And I think we're not out of the woods yet. So as we see the economy opening back up, I think we're seeing you know, some surges in cases. So I think in terms of planning, just really thinking about how are we going to operate differently on the ground? How are we going to connect with families? And how do we really support them through this? And if you're like me, there was sort of a period with your agency where, you know, it was just like the immediate crisis and dealing with the immediate crisis. And the question is like, can we now get to the point of saying like, how are we going to continue this in the fall? How are we going to continue it, you know, for the next year, for the foreseeable future, honestly, while life is just going to be, it's going to be different. So I think some of that is I think digital inclusion becomes a lot more important. So figuring out ways to get devices to people and get internet access to them is going to be key, right? And that's a huge divide in our country. And figuring out how to bridge that will be really important to people. I've got a light on a sensor here. And that includes, I think, internet access. And then figuring out how do we do more of our content virtually in a good way, right? So I think a lot of us like had to splash into that. And now maybe there's a moment where we can say, you know, how do we deliver this most effectively? Whether it's therapy, whether it's healthcare services, just trying to learn about what really works and what doesn't work. And I think there'll be potentially a lot of benefits to that, right? Of saying, maybe we don't have to get together as much, you know, in the same room as we once did. Maybe there are benefits not going back totally to the way we were. Maybe that does help solve some of our transportation problems. Yeah, and then I think for those of us who are in the economy, just figuring out like what are the next steps. I think some sectors will actually grow, and I don't know if there are opportunities there. So I think having conversations with your employer partners saying, you know, what do you see as the skills that are going to really come up in the next 6 months that we could be training people for? Those are all, I think, sort of key things to start thinking about, like, what's the 6-month plan right now?
So, and I'm just gonna put on alert the rest of our presenters that I'm gonna do 2 more questions, and then we're gonna switch over to the next part. Ruben is nodding, so I'm assuming I'm right on schedule. First off, I thought it would be helpful, Luke, for you to relay to us. You've done a lot of sort of talking to people in poverty. And I think many of us operate programs and we just wonder, geez, if only people would understand this is their issue, or they're thinking short term, they need to be thinking long term. How do you bridge that divide between the provider who's got a view and the person in poverty who we're supposed to help and who also has a view? How do you bridge that divide? What do those dialogues look like, and how do you structure those?
Yeah. I guess the first thing I would say is encourage the providers to start with listening and try to figure out, what do people perceive as their most pressing needs that you could potentially help address. I believe that if you have something that you think will help people, if you start with actually helping them with something that they perceive as helping them, they'll be more open to what you think matters for them, right? So that is the key. So I think if you care about budgeting, right, helping people learn to manage budgets, you know, from the research perspective, I'm going to say there's actually not as much evidence as I would like, but, you know, budget counseling can help. Budget classes virtually have no effect, but it's possible that you have a program that really does work on that. What is the thing that people, what's like related to that, where people feel like you can do a value added? And then I think they become much more receptive to what you have in mind, right? That if you say, okay, I'm going to this person and they really do understand me, they're listening. And okay, if they say, now that I understand that, if they say this other thing is important, I'm more likely to listen. I think the second thing to remember is, like, seeing your interaction with them in the context of how they're seeing it, right? If you can imagine that. So we talked about the narratives about poverty, right? And I know when you're a provider that sometimes you'll have people who you think really don't care. Maybe you've had an experience with somebody cheating the system, right? And it's hard, those images have sort of undue influence on us, right? So we might have 9 people who really care, trying to do well. They're not perfect, but they're really trying to do well by their kids. We have 1 who is problematic, and then that 1 just weighs on us, and we create policy. I can tell you that 1 bad student evaluation, you know, when I have 99 students tell me that's the greatest class they've ever had, and 1 who said they hated everything about me, I think about that 1 more. So think about it from their side, right? So you know that you're a good provider. You know that what you do matters, but there are a lot of social service providers out there that don't, right? That maybe really do sort of spend more time blaming people for their problems, right? Or maybe really do provide programs that kind of look like your programs that really don't work, right? Or don't seem to serve people, or people feel like they're sort of forced to do it because they want this other thing. So, you know, just as every time we meet a client, we have to do the work of trying not to let sort of the experiences with other clients sort of shape exactly how we interact with them, they're doing the same thing, right? And they're going to have, I like to say, if a single mom wants to go out and find out what she's doing wrong with her life and her kid's life, she has like infinite possibilities in the United States. So how do we counteract that and say, you know what, nope, we're actually for real. And we've got a set of things, and we've got some research behind it, we've got some training behind it, and we think we can help you get to the next stage in your career, and communicate that in a way, you know, just expect that they're gonna, you know, not in every case, but in a lot of cases, people are gonna assume that that's not the case. And listening really is where it starts. I think people really do like to talk about their experiences. They like to be heard. So I think if you can start from a place of saying, I hear you and I understand you, and I'm doing active listening and like repeating back what I've heard, you really can build rapport from people. But they don't start as a blank slate for you, and you don't start as a blank slate for them.
Great. So one last question, an easy one. So we are in this period now where there's a lot of examination of racial justice in this country. Yeah. Of course, poverty is experienced by all different cultures and races. It's not a Black issue, it's not a white issue, but it does tend to concentrate in different ways in different communities. And I'm wondering if you could help us reflect on how do we take the dialogue that seems to have opened up around racial justice in the United States and apply that to our work on poverty? What are the opportunities there, and what are some of the pitfalls we should be thinking about?
Yeah, I think that's absolutely right. And it's been a bit of a sea change in poverty research, right? Where I think a lot of poverty scholars for generations have really not wanted to feed into narratives that sort of equate poverty and the welfare queen as being strictly about people of color, right? So a lot of the emphasis was in saying like, hey, when you look at the data, lots of poor folks are white, and a lot of the challenges are the same, and trying to sort of broaden that. And I think there still remains an argument a lot of the time for universal policies, sometimes having the biggest sort of equalizing force across races. So I'm a big fan of child allowances. So most Western industrialized countries say, hey, raising kids is expensive. We're going to give every poor and middle class family a $250 or $300 per month per kid to help them do it well. And Canada did it, and it reduced child poverty by like 30%. And one of the things that we have found just recently by some analyses of some colleagues of mine is that that type of program in particular, it would cut poverty overall by a third. It would cut poverty among African-American children by half. And the reason is a lot of the policies that we do have that are around work actually are inequitable. So many kids, especially kids of color, get left out, or they get less, right? So we have a racially unequal safety net right now because of the systems level issues of where people are embedded in the economy and all sorts of other outcomes. And so by treating everyone the same, we reduce racial inequality. But I have grown to think that's not enough, right? And we, in particular, we have a long history. And in the work on poverty, if you read, William Julius Wilson has a great sort of set of writings about what happened, especially this century, right? And we can go back many centuries, especially for Black Americans, and how they have been persecuted, how anytime resources were provided, right, there were ways that systems have stripped those resources. And you could sort of follow that long-term history right up to today, right up to George Floyd. And so I think we need to address that as a country. I don't 100% know exactly what that looks like. We're starting to look at poverty solutions, at issues around, like the evidence around police policies, right? And what could be done on that. We're also starting to look at reparations and say, what would a serious effort at reparations look like in the United States? And so understanding poverty affects everyone, right? That is still true, but understanding that people of color, and especially Black Americans, they have a particular set of disadvantages, and there's incredible historical embeddedness, right, of what especially white Americans have done to perpetuate that needs to be addressed. And I have come to think that we need to do that before we're ever going to move past a lot of the challenges that we have.
Luke, thank you so much for sharing your perspectives and thoughts. Incredibly thoughtful, obviously, and really helpful start to this conversation. We hope we can continue to engage with you in the months and years to come. Thank you so much.
That'd be my pleasure.
We're going to turn to the second half of our program, which is really an opportunity for us to mine the experience of our peers, and in particular, the experience that's been made possible by a really amazing partnership that the network has put together with StartCo and Andre Fawkes. We got to know Andre in Atlanta as we kicked off our poverty initiative work there. And in the year and a half since then, we've now had an opportunity to see how that plays out across multiple peers. Just a little bit about Andre. He's the president of StartCo. He has been a leader in entrepreneurship and thinking through innovations in ways to address problems, persistent problems. He's been a great thought partner with the network in developing our thinking about poverty and exploring innovative approaches that some of our members have been using. And so with that, I'm going to turn this over to Andre, who's going to bring in our peer panel. Andre.
Great. Thank you, John, for that introduction. And hello, everyone. Also want to give a special thanks to Ruben and the network for allowing us the opportunity to work with these agencies over the last year or so. And basically what we did was we took 3 regions and the agencies within those regions, Philadelphia, Columbus, and Detroit, through an innovative building process. It's very timely to hear Luke's discussion, about getting out and talking to clients and being very human-centered in our approach and doing the listening that's out there, because that's really the root of the work that we were working on over this past year. The process involved doing a customer discovery, testing 4 hypotheses around the concept or solutions they wanted to launch. And that was around the problem and making sure we're being very specific and making sure that problem matches up to the solutions that we want to bring to the community. What value are we actually going to map out and deliver? And then also, how do we fit into the behavior of the clients that we're going to be working for? And we took a very, human approach to this and really looking at the client journey. And so we spent 6 months with these regions and really helped them kind of move these solutions forward. And you're going to hear 5-minute pitches through a PowerPoint presentation by each of them, followed by a little question and answer that we'll get into. We also wanted to make note of, obviously, the pandemic and what's going on out there. And so we'll talk a little bit about that as well. And so we're really just going to go ahead and hop into the first presentation. And first up, we're going to have Jewish Family and Children Services of Greater Philadelphia. And we're having Courtney Owen, the director, and Individual and Family Services, and also David Rosenberg, the Senior Vice President for Programs and Strategy. And I'm going to hand it off to them to walk you through their pitch.
Good afternoon, everyone. Courtney and I are here to present the JFCS Fellows Program, an innovative adaptation of a peer specialist model. So to paint a picture, Philadelphia is one of the poorest cities in America. 25% are at or below the poverty line. And most of that income is going towards the essentials such as food and rent. In terms of Jewish Philadelphia, Luke mentioned SNAP benefits earlier. So according to the latest population study, 19,000 Jewish households in our area are eligible for SNAP benefits, but only 43% utilize it. So clearly there's a lot of need and the ability for us to help enroll more people. Next slide, please. Actually, if you can go back, sorry, I thought that was the previous slide. We're all in the midst of the pandemic and it's impacted our clients also. On this slide, you can see the number of cases and deaths in Philadelphia. The unemployment rate has skyrocketed since April. JFCS has mobilized quickly, adapting programs and securing funds. And you can see how we've responded in various ways at the bottom of the screen. Next slide, please. So this slide shows some of the key barriers for our clients. And Courtney and I just want to highlight where it says lack of engagement. We've observed that after a client receives help, many only connect with JFCS once they're in crisis again. And When we reassess, we find that they have worse stability scores and they consume more care management hours. And that's really the crux of the issue that we were hoping to address through this fellows program. Now I'm going to turn it over to Courtney, and if you can advance to the next slide.
So this is the story of Margaret. Margaret and her husband Matt, both in their mid-40s, they came to JFCS for support, and after their sudden and unexpected unemployment created a financial crisis for them. They found themselves after several months losing their townhouse that they were renting, and they struggled to find shelter for their food and for themselves and their 2 children. The family experienced a great deal of trauma, and they were focused on reacting to the immediate crisis. So building trust, rapport, and engagement was difficult with this family as they were in different places asking for help. They felt a lot of shame, embarrassment, and struggled with the idea of applying for public entitlements and asking for financial assistance. This led to a lot of missed appointments, which further deepened the issues and prolonged the solution. JFCS supported the family with referrals, access and application to public entitlements, financial empowerment coaching, family intervention therapy, financial assistance, and lots of support. Finally, Margaret and Matt were able to regain employment and begin getting back on solid footing. Next slide, please. JFCS proposes a pilot program where the peer fellows will be peer supports, as David mentioned. The fellows are the solution. The care managers will continue to provide existing services. We know these services are needed. They're the services that Margaret and her family receive. The care manager's perspective will be different with the fellow on board, who can help them understand and deepen their compassion and validity with the client's concerns, needs, and wants at every step. The care managers will continue to lead the case. The fellows will support by increasing the number of contacts, share their stories when appropriate, connect with the client on shared experiences, and help to be a living example of how trusting the process and motivation can be effective and lead to goal achievement. Fellows are previous care management clients seeking competitive employment. They're compassionate, able to navigate systems, resources, able to work as a team, communicate with others, and they're the demographic mirror of our current care management clients. The fellow is doing the role from the perspective of lived experience, and we can't discount the validity of that. Next slide, please. Transitioning from the reactionary care management to a comprehensive model to address current barriers and develop future planning and goal setting. That's the benefit of the fellow. Reducing waiting times, increasing rapport building and efficiency and engaging new clients will reduce recidivism, and services provided through a trauma-informed lens will work to improve outcomes and use data to demonstrate the impact of the program. Fellows will help support the road to faster recovery and maintain client stability for a longer period of time. Next slide, please. The current landscape is peer support is more than a stopgap. They're the golden thread piecing all needed services together through the relationship developed and trust built. Our program offers flexibility, data-driven outcomes, no cost to the client, it's accessible, and our care managers and leaders are experts in their respective fields. Next slide, please. In year 1, we'll plan to hire 1 fellow to pilot the program and serve 25 clients, demonstrate the benefits of the program through data, deepen community partnerships, and demonstrate the impact for existing care managers to increase buy-in of our internal team who play a key role to the success of this pilot. In year 3, we'll have hired 3 fellows who serve 100 clients, solidify stable funding sources, and develop a model for replication and engage interested partners. And we'll use that data to show the financial impact. Next slide, please. So far, we have held several focus groups and interviewed 35 current clients. We've done a thorough data review of existing program and to identify the need, confirmed partnerships with JEBs, engaged JFCS internally, written and submitted grant proposals, participated in technical support, developed the program model, and done a lot of discovery with multiple community partners and began cultivating donors. Next slide. Now we're going to continue ongoing feedback from potential fellows, engaging JFCS board members, pitch new partners, develop dashboards for the new model and evaluation of pilot program, and determine the cost of someone on the waiting list. Next slide.
So the program will be housed within our Individual and Family Services Department, which is a multidisciplinary team. And you can see some of the specialties that we have, including financial empowerment and benefits enrollment. And that will enhance the peer's work, just as the peer is enhancing the work of that team in JFCS. Next slide, please. As we implement the Fellows Program, we're seeking funding to cover the fellow and related costs. Training, a key lesson of the pandemic highlighted the technology needs of our clients, and we need to explore that further. And also volunteers to mentor the fellow. We'll look to learn and partner from our friends at JEVS Human Services and their mentorship ideas, which have always been really great, and that could be exciting partnerships. Next slide, please. So here's how to reach us. Courtney and I are happy to discuss the model and its replicability. And finally, we want to thank Andre and Starco, and then Ruben and the network and its innovation and grants committees. And thank you. We're happy to answer any questions and discuss.
Great. Well, thank you, David and Courtney, for walking us through that great presentation. Just a couple of questions to hop into. I know we were talking a little bit about staff and the hard work that you do to maximize their impact. Could you shed a little bit more light on how you're doing that and going forward?
Well, one of the ways is the staff are really important in validating and building the relationships with our clients. And we want our staff not to just resolve the immediate crisis that a client is experiencing, but to help hold their hand through the whole process and reach long-term stability and maintain that motivation throughout. So we really want to offer training for our staff to bring in the peer and then have the peers so that they're there to help teach the staff and train the staff and remind them of what it's like to be the person sitting across from them asking for help, so that they can really build engagement and deepen those relationships. So our clients stay with us rather than just come to us for the immediate crisis and then disappear and then come back 6 months later asking for the same thing. So David mentioned it a little earlier. We did a deep dive into a portion of like a cohort of our clients who are identified as very high need. And what we found was that the clients who were taking the most amount of time for our care managers were walking away with the worst outcomes. And so that was kind of a really significant tipping point for us to figure out, where do we go from here and how do we better engage this group of people so that they're not coming back at a rate of 20% recidivism, but rather they're staying with us for a year and a half, and then leaving with really good solid footing rather than coming back every 6 months asking for financial assistance.
Great. Thank you. And just want to make sure we save time for a couple more. Had one coming in from Dr. Susan Seeley. There is a question about where do the fellows come from? Any qualifications that they must have?
So the fellows are, as part of the peer model, the fellow is going to be like one of the clients that we work with, and so as part of the process that we did, like with Andre's guidance, we conducted some focus groups of not only our staff, but of clients that we've worked with. And during that process, we actually identified some potential peers who could serve in that capacity. In terms of their qualifications, I think that we're really looking for clients who want to make a change and to be able to gain new skills, and so there's going to be a training process that we're going to do using the peer specialist training. And then we also, in developing the program, we partnered with JEVS and they have a work ready program that we could potentially utilize to help those people, after they gain these skills, to then find further work beyond the fellowship.
And I guess lastly here to wrap up, we went through a building process with you. Is there anything that you're taking away from that process? Any key insights or lessons learned that you were able to gain access to?
Yeah, I think there were a couple of things. One, just the program development. A lot of times we get funding or we get asked from funders, what do you need? And we sort of run into just creating the program on the spot at the same time that we're starting it up, and we don't take 3 to 6 months to really develop the program before implementation. Going through this process, I think, really highlighted a lot of strengths to doing it this way, and the data that we went through and sort of mined through, and the trails that it led us down. We ended up making a lot of changes along the way to our existing program just based on those things. So while it really helped us to hone into what is the actual need and how are we going to implement this pilot program to address that, but what might be some other little things along the way that we can course correct on to continue getting better outcomes. So the development process and all the discovery was really, really impactful.
Yeah, I would just add that I think that, that STARCO created the safety for us to be able to look at these things over and over again. And so, and to sort of note that, we created the initial process of the program, and then we revisited it, and we, edited and adapted. And I think that, as, our sister agencies are developing programs, if they have the time to kind of look and revisit and hone things, it can really help a process. And I think it really helped us as well.
Well, great. We just want to say thank you for the presentation. That's all the question we'll be able to do at this point. And we want to quickly move right into our next presenters. We have Jewish Family Services of Columbus. We have Karen Mosenser, who is the CEO, and also Melissa Starr, who is the Director over Workforce Development Services. We're going to hand it off to you to walk us through your presentation.
Hi, I'll jump right into ours. The problem that we were solving for was our experience that people who are living in poverty, experiencing poverty, often lack the time and tools to access the help that they need. So I want to illustrate that with the story of Sarah, who was a client, actually represented more than one of our clients, several, a young mother of two, a daycare worker, and living a middle-class existence, but was going through a divorce with her emotionally abusive husband. He had moved out, he'd stopped paying the rent or any of the bills, and her $10 an hour income that had been supplemental was clearly not enough to help her cover the bills, and certainly not any emergency expenses. So Sarah had to take on a second job. That second job meant she had limited time with her children, and then her ex took that as a reason to try and seek custody. So Sarah had gone from a seemingly position of middle-class stability to circumstantial poverty and a risk of losing custody of her children. She had no idea what kind of help was available, how to access that help, and she had no time to figure it out. I'm going to kick it to Melissa now.
So working with StartCo, we really started with how big was our problem. We realized, looking at our workforce programs, that we had 80% of our clients were experiencing poverty. They struggled to access our services in a traditional manner, and many more were working more than one job to meet ends meet, and maybe that was underemployment. Well, now, since March and COVID, everyone lacks this access and the services in a traditional manner. In order to transform our problem, we identified a need, a technology-enabled integrated service delivery hub. We wanted to allow our clients to access our service virtually outside of traditional business day hours. The benefits of this is really the design automation, on-demand services, and our model was coming from a place of evolving in a reactive way to what our clients were coming to us with, to a proactive model. This platform will provide efficient and effective services. It meets people where they are, and it saves our staff time, just as it saves the client time getting to a place of stability. To highlight, though, what really is important to us is that we think this model will help us serve more people. So from our idea to action, initially, we were really challenged in adopting the solution across by inviting staff in for engaging in the process. I was working with StartCo. We were fleshing out our idea, the need. We were doing client research, creating that pilot concept, but we really needed to bring staff in. So at that point, we integrated a small working group, and that's where we spent time reviewing process. We were drafting concept maps, and we invited staff to, in a full manner, and quite frankly, in a staff meeting, to use Post-its to put their ideas on the wall. Well, we were stuck in progress, the Post-its, but COVID really changed that, and this was our catalyst for change. And I want to give a shout out to Luke, our initial speaker, because he really spoke to this point. The action of staying at home during COVID has been an overnight and instant virtual service delivery change for us. COVID made it necessary for all of our staff to take that leap with delivering services virtually. So this inspired a place for content creation where our staff really has felt empowered in their expertise and owning new technology opportunities to get involved. So we've been excited with the progress we've been making, both through the planning and the switch into COVID and the stay at home. We've automated our intake process. It's now on our website for 24-hour access. And we've really seen that exchange between the front line to the back engagement of our staff. We have new content and we're using new technologies to record and make this possible and available to our clients.
Okay, clearly the social landscape has changed quite a bit since we got this idea and started working on it a year ago. Now virtual service delivery, for very different reasons than we initially envisioned, is the new normal, and there is no turning back. Now we'll be doing this kind of service delivery for the foreseeable future for safety reasons, and also because it's effective and it helps us serve more people. The other thing that we're seeing that is different now is the increasing need, the increasing number of people in need, and the increasing complexity of that need. So being able to serve people in a more integrated way and integrated across the different types of services that we deliver at the agency is more important than ever. And our ability to do it effectively and to be able to track it is more important than ever. The other thing that's obvious to all of the people on this call is the funding uncertainty right now. And that's uncertainty around the amount of funding and the focus of the funding. So that also has a big impact on where we go with this. In terms of where we go from here, we have, as Melissa said, this whole stay at home was a real catalyst to get our staff leaping in and creating content. So we have a lot of content that's being created all the time now. The question is, we still need some sort of a platform, the platform we envisioned, where it is more accessible and can be delivered in an integrated way. And of course, seed funding to help us do that. And I think I'm gonna leave the scalability pieces. We may get to that with Andre's questions, but in the time we have left, I wanna take us back to Sarah. She was the young mother who needed emergency cash, she needed legal help, she needed counseling, career coaching, she needed connections, and she really had lacked the knowledge of how to get at the available resources and certainly lacked the time to do it. So let's look at really our vision for this hub, and this is the impact on the life of someone like Sarah. This is our picture, and some of it is actually happening now. Some of it has yet to happen, but it's what we're working toward. So here's Sarah's news story. She gets her kids in bed, and then she accesses our client portal, where a chat feature walks her through it, asking her questions about her circumstances, so we can collect information about transportation, childcare, food security, all of that. She is prompted to download our app, which she does. The next morning, there's a notification that pops up on her app. It's a voice message from her new case manager. The case manager has invited her to come to the free legal clinic next week and asked her to fill out a short form on the app that will provide information that will enable us to provide rent, utilities, and other emergency financial assistance. And through the app, she can set up a video meeting with her case manager for later that evening. So while her kids are napping, Sarah can also listen to a short podcast about job search during COVID. That night, after her kids are in bed again, she has her first video chat with her case manager, who helps her fill out some forms for available benefits, talks her through what is available, helps her schedule an evening session with a career coach for later in the week. She makes a counseling or an appointment for telecounseling with one of our counselors, and she registers for a virtual workshop on using meditation to reduce stress. So that really gives you a quick picture of what our vision is and some of the things that we've been creating. Sarah went from one night where she had multiple urgent needs. She didn't know where to turn for help, and she felt completely alone. And 24 hours later, she had the knowledge that there was a team behind her that was already starting to provide help across multiple service areas. And this was happening on her time and in her control in a way that empowered her so that she can move toward a more stable future. So I would like to again thank the network and Ruben for making this opportunity happen, and the Weinberg Foundation. And a huge thank you to Andre and the team at StartCo, who spent way more time than I'm sure they promised to with us, working us through this, and has continued to help us. And it's been a great process, a great learning opportunity that's had an impact all the way across our agency.
Well, great. Thank you for walking us through everything that you all are working on. Just a couple of questions. Wanted to learn a little bit more. I know we had a conversation about the pandemic and it's forcing you to look at other things like the digital divide. You heard Luke talk about that a little bit earlier. Tell us a little bit of how that's affecting you.
That's definitely one of our key areas of focus right now. So both within using this new technology platform that we're looking to enhance and create, we've really looked for partners in our community to get clients that we've been working with for many months, that new technology. We want to be cognizant of how and intentional in that way, rather than just connecting with partners to provide the technology, but rather training. So we're having those conversations now, but we know that's the next step.
I'd add to that too. One thing that our staff, I think, has become pretty adept in over the last 6 months or so is figuring out what tools are accessible based on what technology you have. So there are some tools that are, like our TANF team has been working with clients who, if they have a computer, here are the tools we can use to work on work readiness or for other access. If they only have a smartphone, here are other tools that are usable and that work. So we're really we're gaining an understanding of kind of the impact of that divide, and also tools that help us train people as if we are helping people. There are some opportunities in the community to help people acquire technology, and then we're learning tools. How can we be side by side with them virtually, providing some training? But yeah, I think COVID has pointed out more than ever the digital divide and the disparate impact on people of color. So it brings in those issues as well.
And then real quickly, one last question here. Anything that speaks to the process that you went through, that uncover anything, any key insights, that maybe a light bulb went off or something that helped you along the way?
Yeah, I think working through the process with your team has really helped us both analyze and create a map of how we scale, and where we spent what felt like many moons on creating and planning for the process and our pilot. It really put us in a position to jump right in and practice some of the things that we were intending to do. So where we really were honing in on creating the ask and preparing ourselves to take this as an idea out into the community, we were in the same sense testing out these technologies that we wanted to implement. And it really helped us really get to that place where we can now go from using client discussion and survey data, but showing progress in just this new phase of implementation.
Good. Well, I think that may be all we have time for today. Just want to say thank you to Karen and Melissa for your presentation. And we want to quickly move into our next one, where we have, it was a joint effort through 3 agencies, JFS, JVS, and Yad Ezra of Detroit. We have Deanie Peterson, who's the Chief Program Officer of JFS, and Jason Charnas, who's the Director of Business and Career Services for JVS. We're going to hand it over to you to walk us through your presentation.
Thanks, Andre. So, hi, I'm Deanie Peterson, and with my colleague Jason, we are representing Jewish Family Service, JVS Human Services, and Yad Ezra, all of Metro Detroit. And in our community, all 3 of these agencies provide services to address poverty and across 4 different programs. So when we stopped to consider what could be better about our approach to address poverty within the Jewish community, it became clear that there are inefficiencies within the current system, both for our clients, the people we serve, and for the staff, the providers. There were clients that we identified as being able to benefit from multiple services, but they really struggled to utilize them. When we looked at the clients we were already serving, we identified between the 4 of us over 100 families who we felt like could benefit from more of the services we were offering, but weren't able to take advantage of them. And for those who were, what was that experience like for them? They often had confusion about which provider was offering which service. We were asking for them to repeat their story multiple times, sometimes asking for the same information, going through the same process or filling out similar paperwork. And for our agencies, the staff were taking time just coordinating between us. So it resulted in a duplication of service. And on the other hand, because there wasn't one agency with its arms around the whole situation, sometimes things fell between the cracks and there actually was a gap in service. When we've been looking at this from the perspective of COVID-19, we only expect to see an increase in the number of households that could benefit from multiple services to address basic needs from our employment services and our case management and our food and our budget coaching. And so we only expect the problem to be multiplied. Now, one thing that some of the other agencies have shared is that in going through the process with StartCo, we were really encouraged to challenge our assumptions. We walked in thinking, this is what the problem looks like, but we went through an extensive process of interviewing clients, talking with staff, doing data analyzation, and really looking at what we call the client journey. Now, this is a very rough picture of that, but what we learned is that when clients were accessing all 4 of these services, there was a similar pattern in how they did it. Even though the service that was offered to them was different, they made a contact to request service. There was a waiting period while they were assigned to a staff person. There was an intake appointment, and so on. So our goal really became, how do we turn this process into this process? Going through, instead of 4 different programs to access support in areas of basic needs, going through one program. And we wanted to have one provider, which was a partnership between our 3 agencies, where staff would be cross-trained in the core areas of service. And from the client experience, they could speak with one practitioner, one provider, and one from one service location.
And then we looked at what the benefits were to us as agencies as well as to our clients. And number one, it's a streamlined process. We're also looking at increasing the self-sufficiency of our clients. Instead of them returning for future help, we expect that they'll be able to receive these services through the one provider and have less need to return to services. We also looked at the difference between what our new model is and what our old model was. Number one, our staff are going to be spending less time coordinating and communicating between other staff and other agencies. Our clients now only need to communicate with one service provider with one set of service goals. And this communication was something that in our interviews with clients was their top recommendation. We expect our clients now can receive more thorough services instead of being referred out to one of the other agencies, and for any reason or any number of reasons, they may not be able or may not be willing to go and follow through. So now we know that they will be receiving these services from a single staff member. Due to COVID-19, we know that there's an increase in the number of households that can benefit from that streamlined process. Now, the design process for us wasn't easy. We had 3 agencies involved, plus staff from StartCo. We were meeting on video well before meeting on video every moment seemed the norm. And we also had based on really great relationships between the agencies. Throughout the process, we saw some staff turnover. This process is one that began well over a year ago. I joined the team at JVS about 6 or 7 months ago. And so that has definitely slowed us down. Our model is to identify and train an employee who is already part of one of our programs, and then provide additional training based on the aspects that they weren't as familiar with. Finally, we acknowledge that we have a need for our clients' willingness to really commit to what the program was. Success for us is about identifying the right clients, forming the right relationships. We plan to utilize our current intake methods for screening so that we are identifying clients that can really benefit from this enhanced process and will benefit from multiple program services. Success is also based on the relationship and the trust between our clients and our staff and our agencies. And again, we expect a high level of engagement and commitment from all sides to those service goals. As we look at the scalability, number one for us is staffing. The more staff we have and being able to really provide them with the training necessary is going to increase the number of clients we're able to serve through this program. Funding, of course, whether it's from our internal budgets or more likely through external sources, will be required. And then for us to increase our outreach and our marketing so that those that can benefit in our community are more aware and those that can help to refer are more aware. So what have we accomplished and where do we sit right now? Number one, we went through a really thorough research and development process guided by StartCo. We began by learning about who our clients are and who was being served by each of these different programs. We explored, we discussed what the problem was and what we thought the solution should be. We researched to understand the problem we were trying to solve through interviews with clients and our staff. We reviewed our agency and community statistics and demographics. We gathered client feedback. We did not rely on our assumptions and really worked to determine if the problem we were focusing on was the right problem. Finally, we designed a new service model for us, for our community and our agencies. We identified a staff. We were initially planning to begin with one staff, but based on wanting to get a pilot program started right away, we identified 2 staff that would meet with our clients together. We were set to begin that pilot phase and then COVID. And so we have put a pause on that. With that, I want to thank Andre and StartCo, Ruben, and the network on behalf of the 3 agencies for the assistance, for the help, and turn that over to Andre for any questions that he or anybody else might have.
Sure. Thank you for you both walking us through that presentation. A couple questions real quick here. You know, how much time are we talking about in terms of savings here? I mean, it seems like, you know, you're talking about some efficiencies in that supply chain there. Could you elaborate a little bit?
Yeah, absolutely. So time-wise, a client, if they're utilizing all 4 of those programs, could have an intake of 6 to 8 hours, plus any communication between them and our staff setting this up and preparing materials. So that time we expect will drop to maybe 2 hours, pretty significant. Also, really streamlining the staff communication. We don't have to spend time staff communicating with other staff. Do we have waivers signed? Or do we have those releases signed? Can we communicate? Who have they met with? Have they followed through? We know that's all now happening under one roof, through one provider, through one staff.
Mm-hmm. And I guess that's speaking a little bit to this cross-trained staff approach, you know, versus this overall team approach.
Yes, one of the models that we looked at the beginning of the process was Center for Working Families. And that was, we started out thinking, okay, we just need a team, taking staff from each agency, a team to come together to work with this client. And when we actually broke it down hour by hour, we said, well, how often is that team going to have to meet? How many hours are they going to spend saying, well, who spoke to this person on Monday? And now I'm planning on emailing them on Wednesday. And when we added up that time, it wasn't a huge time saving. And so we looked at pivoting our model and said it was much more important to have cross-trained staff. Even though it's a little bit more complex to find the right staff person and provide that training to them, the savings in terms of staff time and in terms of efficiency for the client made that change worth it.
Yeah. Well, well, good. Thank you. That's probably all the time we have for questions. Just want to thank all the presenters today for walking us through the work that you all have done. I know it's been a little bit of time and a little bit of work, but hopefully it paid off. So I'm going to hand it over back to Ruben. And again, thanks everyone for your time.
Thank you, Andre. And again, thank to all of our presenters for your thoughtful, your passionate, and your skilled presentations today. Luke is no longer with us, I believe, but I also want to give a shout out and thanks to Luke Shaefer at U of M for his guidance and inspiration. It is disappointing that we aren't together in person, but still, I'm grateful for the opportunity to have this time together. I want to also give a shout out. Andre did not mention this, but this Jewish Poverty Challenge was the first project of the Network Center for Innovation and Research. And we are pleased to be able to offer a year 2 version of the Jewish Poverty Challenge, which will be announced in this week's newsletter coming out on Friday. We're going to be pivoting, as is the term that everybody is using these days. We are going to be pivoting the design to find a way to incorporate the training and the learnings for the entire network, as well as a more focused work for up to 10 agencies this year. So I encourage you to look at that material. And lastly, later this week on June 17th, we have a Vision 2020 webinar presentation with our partners at the Claims Conference. And on June 18th, we have a Vision 2020 webinar with a supporting sponsor, ResCare, addressing the topic of compassion fatigue. So I encourage you to consider those as well for this week. With that, I'm going to thank everybody once again, remind you all that the slide decks and the recording will be on the network's members portal on our website tomorrow. And for those non-members with us, if you'll be in touch with us directly, we will get you the materials. Thank you all. Stay safe, be well, and we'll see you again soon. Thank you, everybody.
Thank you.